Are the words of this old Welsh folk song evidence that the widowed system was invented in Wales? The north coast of Devon and the Bristol Channel with the usual southwesterly blowing. With the Bristol Channel, our Welsh widower is on his last lap from France, and his landfall will be the Gower coast just south of Swansea. The first loft he comes to is the oldest in Wales and probably one of the oldest anywhere. Culver Hole is a medieval structure where a natural cliff cave has been walled off to bring the feral pigeon, the native rock dove, under some sort of control. This is a fair indication of how pigeon keeping and pigeon husbandry started, certainly in coastal areas, but we will take this as evidence now that pigeon keeping started in Wales as well. Here we have two facts. Culver Hole on Gower, and the words of an old Welsh folk song. We put these facts together and then we make a flight of fancy to join our pigeons. A flight of fancy perhaps, a flight of fallacy would be better. But isn't this so true of so many things in pigeon sport, especially when it comes to talking about keeping the birds healthy? Hello, I'm Frank Harper. I live in Swansea, not that far from Culver Hole. Culver, by the way, is an Old English term for pigeon. Gower was a 12th century Norman Flemish settlement. I've been a pigeon fancier for some 50 years, and like most pigeon fanciers I tell a good tall story. But from here, no more tall stories. I'm putting on my other hat. I'm a veterinary surgeon with a special interest in pigeons. This video is an attempt to help you, the fancier, sort some of the fact from fallacy, to help you sift your way through the plethora of must-have products that you see advertised week after week. If we can do that, you'll probably be more effective. You'll certainly save some money. In part, the videos are based on the books that I've published. These are well illustrated, but with still photographs. With a video, I'll be better able to come at it from a different standpoint, a complementary standpoint, and explain in a little more depth just what you're looking at when we're on screen. So if you're ready, here we go. Right, we're starting down the road of this video, a road that's a little bit of a mystery tour for both you and me, because I'm not quite sure what we'll cover in the next hour or so. But the aim is to cover 3 of the most common telephone calls that we get asking help. That's paw droppings, wing problems, and bringing the 2 together with salmonella. And the 4th topic will be highest on the fancier's wish list, the topic of what do I see with my microscope. It's the problem of paw droppings that we're going to start first, but before we talk about paw droppings, we'll have a quick look at where the normal dropping is formed, where your food bills go really. On my right is a diagram of the pigeon's digestive system. The bits that's missing here is the crop. Crop's purely the pigeon's lunchbox. That's where it carries its food, that's where it carries its water. True digestion starts in the proventriculus. That's the true stomach in a bird. That's where the first of the digestive juices are produced. From the proventriculus, food moves into the muscular gizzard. The tough lining of the gizzard and the grit it contains starts to pulverize the food. Part pulverized food moves back to the proventriculus where it gets more juices, back to the gizzard where it grinds again, back and forth until it's a finely ground powder mixed as a soup, and from there it moves into the small intestine. First part of the small intestine is the duodenum. In the loop of the duodenum you see the pancreas. That produces further digestive juices, as does the liver. The liver is the master gland of the body for most of the body chemistry, but it has an important digestive function. It produces the green bile that enters the small intestine and the gizzard. stains the wall of the gizzard and causes the green coloration to droppings. A green coloration that varies depending on just how much that bile is getting through. From the small intestine, the food moves on through the bowel. In its transit through the small intestine, digestion occurs and most of the nutrients are absorbed. By the time the food moves on to the large intestine, most of the absorption of food has already occurred, but water is taken out, and what arrives at the inner vent or the cloaca is a fairly well-dried dropping which consists of the fibrous residue that the bird can't digest. In this part it's mixed with the output of the kidneys. The kidneys lie on either side of the bird. A tube carries the urine into the cloaca. Partly liquid urine, the liquid fraction is normally absorbed into the dry pellet here, and partly solid urics. These form the white cap, which you will see on the normal dropping. Here you see the cecum. This is, corresponds to our appendix. It's a much larger structure in poultry, and it's a primary site of coccidiosis. This partly explains why pigeons suffer less from clinical coccidiosis than do chickens. So there we are. That is the normal gut. That produces the normal dropping. Where and how can it go wrong? We return to the crop. Purely a storage organ. Crop binding, common in chickens because they eat chaff and fibre and sawdust and all sorts of rubbish. It's very uncommon in pigeons, but what you do see is food retention in the crop, sour crop. But this is seldom primarily a crop condition. It's a result of food being held back and literally going off. It usually means that there's an obstruction lower down, often a canker abscess in this region, possibly young bird sickness where the proventriculus is too inflamed to accept food, maybe impaction of grit or a 2-inch nail stuck in the gizzard. How can you tell they've got that? Well, since the gizzard is spiked by this nail, it can't contract, and often you'll see whole seed or husks in the droppings. Liver abscesses, lack of bile, tumours, ulcers, build-up of worms. This can obstruct the duodenum. The end result is the food can't go through, and it remains in the crop, and it then goes off. If you've got a bird that is holding food in its crop, and never assume that a bird with food in its crop is eaten. There's a very little point in giving it medicine. There's no absorption of food in the crop, there's no absorption of medicine. So if you're using antibiotics in a bird with food retention, you really need to give it by injection and bypass the crop and make every effort to get that crop empty. This might be by making the bird vomit, say 5 ml of saturated bicarbonate of soda, that will usually make them vomit, or 5 ml of medicinal liquid paraffin. That will frequently oil the works and help things to pass through. But there's very little point in giving pills or potion to a bird that isn't emptying its crop. Try to empty it first, and don't feed a pigeon that isn't eating. It's likely to end up holding that food in the crop. It's not going to go anywhere. It will go off and compound the problem. You've effectively got a hungry bird. You don't feed the horse, you get no manure. So hungry pigeons, or pigeons that haven't had food, will show a small, thin, scant dropping. Green in colour, there's just no food coming through. Similarly, these birds that have got full crops, they apparently got food in them, but they effectively are physiologically anyway starving pigeons. So that sums up crop problems. There's a lot more could be said, but we leave that for now. Proventriculus we've mentioned as the main site of vomiting, particularly in young bird sickness. It becomes very, very inflamed. If you post-mortem them, you can see the injected honeycomb appearance. The gizzard, we've mentioned impaction with nails, and we've mentioned impaction with grit. They also swallow the husks of corn on the cob, that's maize. And very rarely the gizzard is infested with a gizzard worm. The liver, well, the liver adenovirus, herpes virus, canker lesions, salmonella, tumour, worm migrations, canker migration, these can all damage the liver. Yes, you get poor droppings, you get a pigeon going light, but you've got a very sick pigeon indeed. Small intestine, the duodenum, the main parasite of significance there is the protozoan hexameter. Worms, bowel trichomonads, coccidia, they parasitize most of the bowel, and on very rare occasions the inner vent, the lower part of the large intestine, is affected by fluke. Very, very rarely, but it does happen. Obviously not all of these causes will affect all pigeons. You've always got the problem of a flock problem or single birds within the flock. If you do see a flock problem where all the birds are affected suddenly, it's probably something down to your management. Possibly something as silly as forgetting to feed the birds the day before. Possibly a change to a low fibre feed, say a high proportion of wheat. There's always the possibility of going out and eating mosses or other toxic plants. But if all birds are affected at the same time, then almost certainly it's something down to management rather than disease. If a problem starts in a few birds and then more and more become involved each day, then you really want to be looking at a disease problem. Anyway, when we look at droppings, this is what I really like to see. Nice fern droppings, white capped. There's not a lot wrong with this bird. Bit of a funny colour. That brown coloration is because that bird has had some food containing a B vitamin supplement. Colour change can be down to feeding. Beans, peas will produce a darker dropping than light cereals. B vitamins will cause this brown colour. Ignoring B vitamins, if you do see a yellow or brown colour or possibly green staining the white urate, suspect liver disease. There's a lot you can tell from looking at that dropping. They're neatly bunched together. That pigeon has rested well. He's not being bitten by parasites. He's got no skin parasites. He's not being bothered at night by prowling cats. Nice fall of down, nice few feathers on that. That pigeon system is in good order, and there's an awful lot you can see just by looking at the droppings without any further droppings examination. Things can go wrong, and here we have the start. Bulky, greasy, sticky. It sticks on the scraper or it slides off the scraper when you try to pick it up. There's far too much fluid in that dropping. It's coming through the large intestine too quickly for fluid to be absorbed. The bowel is irritated. The bird's obviously got enteritis, and the irritated bowel is producing mucus. That's getting involved in the dropping. It's much darker in colour. It's coming through far too quickly, and so you're seeing the green coloration from the bile further up in the bowel. Here things have gone horribly wrong. This has had to be collected on a sheet of polythene. There's no substance to this dropping at all. Just liquid, bile, mucus, severe enteritis. Almost certainly this bird is not eating. There's certainly no food material in the dropping. The other thing is, note the change in colour in the urate. This pigeon has almost certainly got liver disease. Very sick pigeon indeed. And yet, you know, as bad as that is, it's still only loose droppings. This is a problem of terminology. Loose droppings, watery droppings. Which do you mean? That is loose droppings. True watery droppings is where you do see a dropping, possibly normal, possibly slimy like this, but around it will be a pool of clear water. And that clear water is not truly a dropping, it is liquid urine being produced by the kidneys. So true watery droppings is not a bowel problem at all. It's a problem of excess production of urine by the kidneys, excess production of liquid urine. The birds are drinking a lot, and you'll see this pool of water around. This is an extreme case. It happens to be from a pigeon with diabetes. In the test tube you see a positive result for sugar in the water. But the dropping lies in the bottom, and you can see the pool of water, clear liquid, accumulated in the dish. Diabetes is rare, but you will see watery droppings in your pigeons, mainly in two instances. The wet feeding syndrome, which you see where pigeons are feeding youngsters between 10 and 18 days. This seems to be an upset in the salt balance. and electrolytes are your best control, certainly not drugs. And the other one of paramount importance is paramyxovirus. Paramyxovirus in pigeons that are not really youngsters is the out and out cause of watery droppings. Again, electrolytes are very, very important in the control of this, not antibiotics. You're dealing with a virus, and antibiotics are not going to be effective anyway. And I think we better have a few words about that, because here now at the end of September, beginning of October 1999, the situation is fairly desperate, where vaccinated birds are showing watery droppings. The fancier doesn't accept that he's got paramyxovirus because the birds are vaccinated. This is not the case if you have 10 young pigeons drinking 2 pints of water. You have got a 99% probability that they have got paramyxovirus. And that is what you will see, is this massive thirst, watery droppings, possibly sudden death in some pigeons. You don't need the twisty necks, which frequently show about a fortnight later before you suspect paramyxovirus. Because these are vaccinated birds, very few people are notifying this to the ministry, and so the true incidence of paramyxovirus infection in Britain at the moment is very, very much underestimated in official data. What can you do about this when these pigeons are vaccinated? Well, if you read the recent inserts in vaccines, they will explain what is going on. The vaccine gives partial protection, but if the birds meet a massive challenge, it will crack. And it seems that although the paperwork is filled in, many pigeons are not vaccinated. The ministry knows how many pigeon rings are sold, and the ministry knows how many doses of vaccine are sold, and the figures don't tie up. So there are a tremendous number of young pigeons going into the basket not vaccinated, and the load of virus in the racing baskets can become sufficient to overcome the immune status of your vaccinated birds. My best advice to you would be to vaccinate your young birds twice, because far from paramyxovirus or vaccination being a cause of young bird sickness, the two things are not related at all. The worst that you can say about vaccination is that it is one stress amongst many, but it is one stress that can precipitate an outbreak of young bird sickness in birds that are incubating it. Now I think we will return to the subject of problem droppings, because watery droppings, there's not an awful lot you can see with a microscope. If you suspect paramyxovirus, it's no good submitting those droppings for a laboratory test. It needs testing by the ministry to confirm that. It's the solid dropping, or the semi-solid dropping, that we are going to investigate to try to explain what is going on, try to find out what some of the causes are. I get incessant phone calls. The fancier wants something for bad droppings. The fancier wants something for going light. The pigeon's not suffering from bad droppings. The pigeon's not suffering from going light. Those are the symptoms that the bird is showing. It is actually suffering from some underlying cause which produces poor droppings, which causes the going light. And if you're going to crack the problem, you really need to know what is the cause. Remove the cause and the problem will abate. Right, how are we going to try to find what the underlying cause is? This is where the droppings examination comes into play, and here I hope at the same time you'll find out what you're going to see under your microscope. The standard and traditional droppings examination involves mixing the droppings with a saturated salt solution, straining them, and then collecting a sample of the liquid into a master slide. That's what I use. As you see, it's a glass sandwich, or with your own kit it's likely to be a slide with a well in it, like so. The idea is to fill this with liquid to the top, put a slide on top, and then the rubbish sinks and the eggs float. They come to lie underneath the cover slip on top, and then you can examine them with a microscope. And here now we'll move on to some footage of what you will see When there is something to see, remember that if you don't see something, it's quite possible that the birds are clear. This is a good picture of what you might see when there is something to see in a floated dropping sample. At the top of the picture you've got a coccidial cyst. Below this and slightly to the right is the oblong ascarid egg. Coming back below bull is a capillaria. You'll notice the thick shell and the plugs on either end, and below that again two coccidial cysts. We'll go on to a higher power shortly, but these are the significant findings. Remember, these have been floated out of the droppings with a concentrated salt solution so that the rubbish is left behind and you can see the worm eggs. This now is a higher powered view of the same specimen. You have the two coccidial cysts, then the capillaria worm egg with another coccidial cyst to the left of it. We'll scan up now and see if we can find the ascarid eggs. There we are. Thicker shelled, no plugs on the ends, and 2/3 as big again, or put another way, the capillaria egg is about 1/3 of the size of the typical ascarid. Coccidial cysts for comparison, and then we've got the obligatory bubble. These are the only things that really cause confusion. The black ring can look like an egg, but remember that they're there in most specimens and ignore those. That is a coccidial cyst again in the middle. More coccidial cysts. And that is what you're looking for. The round circle, the central yolk, not quite filling the outside. And the bubble, the ascarid egg, thick shell, the central portion, the embryo fills that shell, and then the capillaria worm, again thick shelled, often green in colour because they do cause enteritis, and you've got the green colour of the droppings with a bird with enteritis. But capillaria is capped. It's got the two caps at each end. Once seen, not forgotten. Seen the eggs of the common roundworms. The message I wanted to get across was the thick shells on these eggs and the problem of keeping the loft clean once you have worms in there. Disinfectants and scrapers won't get rid of them. A blow lamp will destroy them, but you can't use a blow lamp on deep litter, concrete floors or earthen aviaries. So you must make every effort to keep your shed clean. Don't take in birds that are carrying worms. If you can reach this happy situation, you never need to worm the pigeons. But once you are in trouble. And once a year worming is really a waste of time, because from the first day that you worm them, they will be picking up eggs again. For each worm in the bird, you've probably got thousands of eggs on the floor. So remember, worm the birds, but worm the shed as well. That's probably more important. The ascarid worm, the large round worm, which most fanciers have seen. Here we have the house record, 615 from one hen. They're about 1 inch long and about as thick as a pencil lead. Now that hen was apparently all right until she started to vomit. No bad droppings, no weight loss, no going light, until sufficient numbers built up to create a blockage, and then no droppings, of course, nothing was coming through, and the hen did start to vomit. On my right there's a pigeon that wasn't quite as lucky. Here you see a similar number of worms have built up, but they've actually ruptured the gut and the pigeon died from peritonitis. Now that pigeon had been wormed early in the season. So this is what I mean by an annual worming might be a waste of time. No worms, it's not necessary. But if you've got a heavy worm burden, they can still build up in subsequent weeks. Normally when pigeons acquire a worm burden, a few worms inhibit the development of baby worms coming along behind. If you put a clean bird or freshly wormed birds into an infected environment, they can get a massive dose simultaneously. They'll all develop, and this is the end result. That's the ascarid, the worm that you'll see. The other common worm is the capillaria worm. This is named the hairworm, but this is very much an exaggeration. There you have your ascarid worm. Remember the size of that. The photograph is taken on a microscope slide. So there's your ascarid there. Here you see a capillaria worm. So it's very little thicker than a cobweb strand. You're extremely unlikely to see it even with a magnifying glass, but just occasionally you will see this worm under the microscope. This is how the capillaria worm appears at low power under the microscope. Notice the eggs travelling through. The female capillaria worm is an egg-laying machine. Much smaller than the ascarid, these are more dangerous since they burrow in the tissues of the gut, cause damage. They can even migrate into the liver. The third most common type of roundworm that affects our pigeons are the trichostrongyles or palisade worms. These break the rules a little. Like the ascarid and capillaria, they're a loft problem where the life cycle is direct, pigeon to droppings, droppings to pigeon. But in the case of the trichostrongyles, the eggs are thin-shelled. They're partly developed as they pass in the droppings, and they hatch rapidly. The larvae come to live in the litter on the floor, and the larvae infect subsequent pigeons. Because of this, these worms are a particular problem in damp lofts or in deep litter, where the deep litter is less than bone dry. On screen, you see a view of a different float. This is probably more like the picture you're going to see with your own microscope. The first object is a little bit of a red herring. This is a feather mite egg, a large egg, thin-shelled. Mites congregate around the rump, and so they're often seen in the droppings. We're looking for the egg of the third roundworm, the palisade worm, presumed to be Ornithostrongylus quadratiatus, but without killing the pigeon to identify the adult, the identification cannot be certain. Our intention is to cure pigeons, and we haven't had the opportunity to post-mortem one of these. Notice the thin shell and the U-shaped embryo ready to hatch. The egg is about the same size as that of the capillaria worm, and here you see an ascarid egg to compare and get your scale right. You may see the eggs in the floated droppings, but if you are so unfortunate as to get a loft infestation, you're more likely to see the larvae if you make a direct smear of the accumulated droppings. That covers the three common roundworms that affect our pigeons. There are a few other roundworms I should mention. These present a slightly different problem, because whereas the other three are an in-loft problem where the spread is by a direct life cycle, pigeon to droppings, droppings to pigeon, and there are consequences of feeding pigeons in the environment in which they live. The other type of worms have an indirect life cycle. The pigeon carries the worm, it passes the dropping, and the dropping is eaten by an intermediate host, whether this be an earthworm, slug, insect. Another pigeon comes along, eats this intermediate host, and then becomes infected. So this would not normally arise in a loft situation, only in pigeons that are fielding or pigeons that have gone AWOL and lived rough. One type of capillaria worm is spread that way. The chicken gapeworm carried by earthworms is reputed to affect pigeons, but I have no experience of this personally. Of this type of worm, the one which is of most significance is the tetramere or gizzard worm. Although this worm is very rare, it is very serious, and when pigeons are affected, the infection can be lethal. Treatment of roundworms. The ascarid is fairly easily cleared out. Piperazine-based products, levamisole-based products will do the job. Capillaria worms are more resistant. Panica is a licensed product in capsule form. Prior to licensing, we found that the 2.5% sheepwormer was effective, either as 5 ml per pint in the water for 24 hours or 0.3 of an ml per bird. The problem with Panica is its propensity to damage feathers on the pip. Avicas tablets claim to be effective without this drawback, but I have no personal experience of evaluating this. It's many years since my own pigeons had worms. Ivermectin is sometimes mentioned. I find it erratic as a wormer in pigeons. The horse preparation, Equivalent, at 1 inch to 3 pints of water, seems to be fairly effective, and that one does work against tetrameres. We've finished our discussion of roundworms. The danger that they present to the pigeons varies, partly related to the type of worm, partly related to the numbers. The other type of worm that you might encounter is the tapeworm. These come in two forms: the long tapeworm, which is quite dramatic. Sometimes you'll see 4 or 5 inches protruding from the vent of the pigeon. And much more common than this is the microscopic tapeworm, and most fanciers have never seen it. We'll show some pictures of these later, but first of all we ought to think about life cycle here again. The direct life cycle of the roundworm, pigeon with a roundworm, egg, dropping, back to pigeon, direct life cycle. The indirect life cycle of the few roundworms we mentioned, but it is of extreme importance in the tapeworm. Tapeworm lives in the pigeon. It does relatively little harm. The head is attached to the gut. It gets its name because the body is segmented. As these mature and move to the back, they ripen and become full of eggs. The segment falls off into the dropping. That is then eaten by a slug or a snail. Another pigeon comes along, eats that. Indirect cycle, but back into the pigeon. Here we have 2 tapeworms. They're each a foot or 15 inches long. They've been in pickle for some time, but they are just 2 single worms. That is the large tapeworm. Here you see the 15 inches of the worm draped on a microscope slide. Far more common is the small tapeworm, the so-called microscopic tapeworm. This creature is at most a 1/4 inch long. You certainly won't see it hanging from the vent. What you will see if you're observant is a pearly segment crawling away from the freshly passed dropping. Tapeworms are dramatic, but they don't present any particular danger to the bird. The most you're going to see is a dropping like mushy peas, even in heavily infested birds. Here you see the segments of the small tapeworm, the microscopic tapeworm, on low power under the microscope. Overlaid is a better view of the segments emerging from the dropping. It's a poor dropping. This pigeon happened to have young bird sickness. Each of the segments is filled with eggs. And the eggs, seldom seen in the droppings, have the typical marks which are going to form the mouth parts on the worm when it invades the new host. Here we have what I believe to be unique opportunist footage of the embryos from those eggs protruding the mouth hooks, prior to invading the tissues of the intermediate host. Don't be under the illusion that isogel is a good medicine for tapeworms, because if you give birds isogel cake, they pass the inert cellulose out as a great long tube. That is just isogel in the dropping. It's not a tapeworm at all. Right, we've had a look at our flotation, the droppings examination. We've talked about worms, and nowhere have I mentioned the dread coccyworm that kills in 24 hours. You'll excuse me if I give a musical answer to that. Coccidia are protozoan parasites. They are single-celled organisms with no body organs as such. The spread is in loft, bird-to-bird, direct life cycle. The oocyst, which we've seen in the float, is passed in the droppings. This is swallowed by a pigeon. It emerges from the cyst and invades the cells lining the bowel. In these cells there's a stage of multiplication, and eventually the cell ruptures and the coccidia are liberated to invade still further cells. And this wave of eruption and invasion progresses through a number of cells and obviously causes damage when this happens. Ultimately there's a sexual stage where they form cysts. These are liberated into the bowel and are passed in the droppings. This damage in the bowel is particularly serious in chickens, but of lesser significance in pigeons. Historically, most pigeon droppings have been examined by people who do examine chicken droppings, and since it's such a serious disease in chickens, they've tended to think of coccidiosis in pigeons on the same level. In my experience, coccidiosis rarely, if ever, causes pigeons to have diarrhea or go light. They are significant. They are significant as a cause of stress to the pigeons, but they're also a result of stress. A high coccidial count is usually a reflection of poor management, particularly overcrowding, or possibly other disease. Trichomoniasis is one example of that. Treatment for coccidiosis, unless you address the underlying problem, your count will revert to what it was in a matter of weeks. So the pre-season treatment for cocci is a total waste of time. You really have to address the underlying problem. If you need to treat for cocci, Apotec tablets will knock them down quickly. Before Apotecs were available, we used a product called Bacox, 0.3 of an ml per pigeon or 5 ml per litre.